Time to catch up via Zoom with a senior specialist in emergency medicine who's based in Melbourne. He's been providing some ongoing commentary on COVID since the very early days of the pandemic. In fact, he's been a regular for a number of mainstream news agencies right across the country. His name is Stephen Parnis. Welcome to Dr. Stephen Parnis. Stephen, welcome.
Thank you very much, George. Good to be here.
What's life been like for the frontline, all those medical professionals you and I have spoken about in the past? What's the last 18 months been like for them, especially in Victoria, where many of them, especially the seasoned professionals, who've never really had to face anything like COVID before?
It's been a long, hard slog, George. I think that's something that really everyone across the planet, but looking more closer to home, certainly in Melbourne, would describe things. We have had some times, maybe over summer, where we could relax a little bit, where we thought that life might be getting back to normal. But then just as you think you can get comfortable again, something to do with the pandemic comes and hits you between the eyes. For health workers, for people in hospitals, it's been worries about spread in the community. And of course, we cannot forget the second wave that hit Melbourne in July, August, September last year, and we are all still scarred by that experience. We've just had this latest lockdown, which continues and will gradually ease, but no one is jumping for joy because we know that it may not be the last one. We have no idea when the pandemic will end, and I think we're all running on empty.
You mentioned that second one that many are scarred over. Did you see a change in strategy, a change in thinking, a change in the way you were prepared for looking after patients? I know that the initial idea, of course, was to make sure that we didn't have the professionals run off their feet, because there was this idea that we, like the rest of the world, would see an influx of patients. That never really happened in Victoria or in Australia, did it?
Well, during the second wave, Melbourne's health system was the one that came closest to getting overwhelmed. I would think it's fair to say with hindsight that we had a lot of pressure put on us, and all of the preparations that we made were absolutely the right ones to make in hindsight. We couldn't have, for example, elective surgical patients on the wards. We couldn't have visitors seeing patients because there were lots of hospitals with lots of COVID patients, lots of intensive care beds taken up, emergency really preoccupied with very sick, infectious people, and thousands of healthcare workers who got infected themselves. And that was last year. So if anything, what it taught us was that for the future, for now, we still have to go through those preparations. Now, thankfully, with the fourth lockdown in Melbourne, those needs have not been realised. We've only got a handful of positive COVID patients in hospital, and we haven't needed the system in the way that we did last year. But what we do recognise is that while it is necessary to make those preparations, the key with a disaster is plan for the worst and hope for the best. We also recognise that it has an enormous price to pay. The impact on people is huge, and you can list all of those things. And to give you examples, one is the person who needs an operation, like let's say a hernia operation, or a colonoscopy to check and prevent cancers from growing. And those things are delayed, and inevitably there will be adverse outcomes. Or even those people who have been in hospital with things like a pneumonia or major emergency surgery, who haven't been able to spend any time with their relatives, sometimes for weeks. These things damage that person's recovery, and you can see them shrivel up in the hospital bed. It's a huge price to pay, and seeing that happen in front of your eyes is something that never leaves you, just like seeing those frail elderly aged care residents die from COVID last year is something that will never leave me.
It won't leave a great many of us. Federal government, state governments, nobody can wash their hands of what happened. That's the sad truth of it. But what have we learned? They're the key things, and can we make sure we don't repeat our mistakes? Are the new strains of coronavirus presenting us with a challenge that we haven't addressed yet?
They are more of a challenge, we think. Again, because things change so quickly, it's really hard to keep up with what's going on. It's exhausting. That of itself is a huge challenge for anyone in the health professions, let alone government, I have to say. But what we think is that some of these more recent variants are more infectious. And they've got some characteristics that make it easier for them to spread and become the dominant strain in certain countries, things like the Kappa and the Delta variant. What we worry about, apart from that increased infectivity, is whether they cause more serious disease. And that's clearly a worry. There was an episode in Bolton in northern England where there seemed to be higher numbers of younger people in hospital, and that certainly got our attention, because up to this point, we know that the biggest risk factor for getting sick with COVID is being older. Correct. So there's all of those sorts of changes, but then there are other things which are not new in terms of dealing with infectious disease or the pandemic that we know work, but if you like, community experience has really made a lot of people hesitate. And some of that is about the pain and suffering associated with restrictions that keep us apart from each other, that stop people from working, that stop us from doing what matters. And then there's vaccination as well.
I was just going to say, we're talking to senior specialist in emergency medicine in Melbourne, Dr. Stephen Parnis. Doctor, you touched on vaccinations. Why are we seeing such a great hesitancy? It seems to me that, and I know from friends and others, that they're saying to us, give me an option of what I can take and I'll go tomorrow. I don't want to be forced into one particular vaccine. Now, is that reasonable to think that way, or is that being unreasonable?
I think hesitancy on the part of the population is understandable. Okay. I think the idea that there are this big number of people who just oppose vaccination per se, I don't think that's correct. There is a very small percentage, maybe 2-3% of the population who just oppose vaccine. They are, and they always have been, and there is always this ongoing issue for people who work in public health like myself against that sort of issue, which is usually based on emotion and conspiracy theory rather than scientific fact. But in the context of COVID, there are a lot of reasons why people have been hesitant. I think a lot of people have looked on suspiciously at the fact that vaccines have been produced much faster than they ever have before. We're usually talking a time frame of 5 to 10 years. What we have in the context of the COVID vaccine is that we had safe and effective vaccines appearing within 12 months. And that is incredible. I would almost say miraculous, but really the groundwork had been done in years gone by. We have good, safe, effective technology, and we also had really every major scientific, government and pharmaceutical resource on the planet directed to doing this, because they know it's the only game changer with this pandemic. But then there are other things happening as well. When you have on the front page of every newspaper, as the lead story on every media outlet, issues around the pandemic, including vaccines, then people will look at that and they will take the positives, but they will also take the negatives and probably focus more on the negatives. And in our context, we have access to 2 vaccines. We've got limited access, and some of that is because we don't make the Pfizer vaccine in Australia, And the AstraZeneca vaccine, which we do make, has also been partly from overseas importation. And some of those have been withheld by countries who have arguably, I think, needed it more, like we had in Italy a few months ago. Then there are side effects of vaccines. Every vaccine has side effect, but this is where assessment of risk happens. The issue of this rare syndrome of clotting, and I'm talking less than 1 in 50 to 100,000, one person in the MCG, that level of risk, and that has gone down over time. The current info is that we've had more than 2.5 million AstraZeneca vaccine doses in Australia. We've had one case die from the clotting. There have been others, but we've got better at diagnosing it and better at treating it. And so we have to weigh that up against the risk of getting the disease. Now, if you get 2.5 million people infected and you have a mortality rate of somewhere between 2 and 3%, that's a lot of people dying. So, as I said, it's unsurprising that there have been so many things weighing on the minds of people. And when it comes down to this issue, I want a choice. Well, when supply is limited, that choice isn't necessarily available. And with respect to the population, we have never really insisted on particular brands of vaccine in any other disease in the past. We have relied on expertise. And in that context, I'm an emergency specialist. I rely on the expertise of my colleagues in infectious diseases and pharmaceuticals. And that's the way that we should continue to go. But when you're afraid and you don't see a way out, you don't know who or what to believe, and we overestimate certain risks and underestimate others, it's hardly surprising that we have the situation that we currently have. And that's where I think scientific, medical, and political leadership needs to come to the fore to help guide people and say things in a way that brings people on board and gets that sense of common purpose, I think.
I listen, and I'm just hoping that there are others who take on board what you've said, particularly from your perspective, and see if we can improve things. Before I leave you, you're a specialist in emergency medicine, as we discussed from the very beginning. Over this past 16, 18 months, have you seen more and more people presenting to you, jaded from a mental exhaustion?
Yes, there's no doubt about that. We've had high rates of mental health presentations in emergency for a long time. Emergency is the place where the problems in our system, in our society, often present themselves. We're the canary in the coal mine. But what I'm certainly seeing even more now, because I'm more alert to it, is that anxiety, stress, mental illness is presenting in all sorts of ways, more than before. Chest pain, headaches, deteriorating levels of energy, even things like people having a lower threshold for their medical problems. So diabetes is under poorer control. People with emphysema are more likely to present thinking that they're having trouble breathing. The list is endless, and we're just scratching the surface of that. And then we have to weigh that up against the fact that, if I use myself as an example, I feel at times I'm running on empty, and it's more of an effort to listen carefully, to care, to give of yourself to people. Things that normally you'd sort of take in your stride become much harder, and you walk away from the shift more tired. So it's a double whammy there, but all you can do, I think, and this isn't just for me, this is for everyone, is to say, take it easy on yourself. You're doing the best you can. We will get there in terms of a recovery, but it's going to take a lot longer than you thought.
Stephen Parnis, thank you for your honesty, thank you for the insight, and thank you for the opportunity to discuss something that has taken a hold on all of us, not only in this state, this country. The other thing that has shocked me over the last 18 months being a newsman has been how we've fractured very quickly. Once upon a time, I thought we were all Australians, and unless it was football we were talking about, and then we went into tribes. But over this past 18 months, I've seen, you know, state over state over state, and it's not about us, it's about them. And that's something we've got to stop in a hurry too, don't we?
I think so. I think we can learn the lessons of history, and that was something that happened 100 years ago during the Spanish flu. I think it also means that as we recover over a period of years, and we've still got a long way to go to get through this pandemic, then it becomes a matter of the highest urgency that we look for the things that unite us. And that's true as a nation, but also I think as a global community, because there are so many things that are pulling us apart from each other, and our quality of life, our ability to descend into conflict, all of those things are dependent on our sense of community.
Well said, Stephen. Dr. Stephen Parnis, our special guest on The Informer. If you like the interview, please make sure you follow us, TheInformer.tv. Thank you, Stephen. All the very, very best.
Thank you very much, George.